welcome to our live webinar. Let me start off by saying happy US Breastfeeding Awareness Month and happy belated World Breastfeeding Week, which occurred earlier this month. My name is Charlotte Stepling and I'm the Nutrition Director for Operation Smile. I'm honored to have this opportunity to welcome and introduce Operation Smile's Nutrition Council for an enlightening discussion on the role breastfeeding plays in the health of infants and the connection between nutritional support and speech development. Through our open conversations from our panel of dietitians, speech therapists, pediatricians, and more, you'll learn about our global efforts to educate and empower families by providing them with the resources they need to ensure the healthy development of their child. For this group of women, their hard work is inspired by their determination to never see a child denied cleft surgery because of poor nutrition. If at any point you have any questions, feel free to drop them in the chat and we'd be more than welcome to answer them. Without further ado, I would love to introduce our Operation Smile Nutrition Council, starting by Ashley.
Hi everyone, my name is Ashley Miles and I'm located in North Carolina. I'm the nutrition specialist for Operation Smile and I work closely with Charlotte, our nutrition director, and our amazing Nutrition Council on all Operation Smile nutrition initiatives. I'm very excited to be here today and for our Nutrition Council members to be able to share some of their expertise. So with that, I'll pass it over to our Nutrition Council members to introduce themselves. Elsa, would you like to start us off?
Hello everybody. I am very excited to be here today to discuss the importance of breastfeeding. I am Elsa, I'm a registered dietitian from South Africa and I'm working in Abu Dhabi. So I'm volunteering with Operation Smile UAE. Happy to be with you.
Thank you, Elsa. And next we'll go to Dede.
Hi everyone, it's such a pleasure to be with you today. My name is Dede Kwadjo, a registered dietitian and nutritionist from Ghana. Volunteering with Operation Smile Ghana. It's once again such a great pleasure to be with you to talk about one of my favorite topics. Thank you so much.
Thank you, Dede. And we'll go to Helen.
Hello, everybody. My name is Helen Kinigopoulos. I live in the U.S. in the state of Maryland and have been a volunteer with Operation Smile for decades. Being part of the Nutrition Council is a great privilege because it is a topic that is close to my heart. So this has been a great experience for me.
Thanks, Helen. And lastly, we'll go to Teresa.
Hi, everyone. My name is Teresa. I'm a pediatrician from Brazil, and I've been a volunteer with Operation Smile for many years now. And I'm very happy to be here speaking about breastfeeding, which is one of my passions. Yeah, very excited to be here.
Awesome. Thanks, Teresa. Well, the first question actually goes to you, Teresa. We know that around the world, only 44% of infants are exclusively breastfed in their first 6 months. We know that it's important for this number to increase and for infants to be breastfed, but can you help us understand why?
Yeah, so that is very important. We do have a low number of people breastfeeding. The importance of breastfeeding is so wide, but we can talk about some of the main reasons why it is important to breastfeed. So one of them is it reduces the risk of death for children under 5 years of age. It reduces the risk of severe diarrhea, dehydration, and pneumonia, and it reduces the risk of being admitted to a hospital. So that is very important. But we also know that it reduces the risk of allergies, diabetes, hypertension, and high cholesterol levels in the future. It promotes, of course, better nutrition. We know that breastfeeding, well, breast milk has all of the necessary nutrition components for the first few months of life. It is the best food until 6 months of age, and it should be continued until at least 2 years of age if possible. It also contributes to the development of the oral cavity, so the muscles, helps with breathing, aligning the teeth, so many other contributions. And it also promotes mother and child bonding. So that is also very, very important.
Awesome. Thanks, Teresa. But when should a mother start breastfeeding, and how does that timing impact a child's development and health in the short and long term?
Okay, so the first thing we need to know is a mother should want to breastfeed. So we need to respect her decision if she does not want to breastfeed, or if she has any sort of condition that prevents her from breastfeeding, we need to support that as well. If a mother is ready and wants to breastfeed, we should encourage that first moment happens in the first hour of life, that is called the golden hour. So that first moment when the child is born, and if everything's okay, the child is breathing well, has good muscle tone, then the child is put close to the mother, so skin to skin contact. And as soon as the child is ready, and so is the mother, then the child can latch and try to start suckling. So that moment is very important first for, like I said, mother and child bonding. So it's the first time the mother is getting to know her child after most of the times 9 months. So that is a very important moment. But it is also important, so when the baby is breastfeeding and is suckling, it is important to produce some hormones that will help with the uterus to contract and stop the bleeding. So that helps like later on for the mother not to develop any anemias after giving birth. That is one thing. And the other thing is, so the uterus goes back to its original size. That is also very important for the mother's health condition. It helps to expel the placenta out. So these are some of the most immediate benefits. Also, the colostrum, which is the first milk that comes out when the mother gives birth for the first few days, is rich in immunoglobulins. So we can say it's the first vaccine for the child. So it prevents, again, for the child, it prevents against infections. And and it can also, just one more thing, it can also prevent hypoglycemia, which is a concern, especially with a few high-risk babies.
So I wanted to add that Teresa, what you've been talking about is the golden hour and all the importance of understanding why breastfeeding is important, especially at the very beginning of life when you refer to colostrum. And I think I wanted to emphasize that is one of the goals of the Nutrition Council and Operation Smile, is to not only educate the mother, but to educate the health professionals or the people who would be there at the birth of the child. So getting information out into clinics, to other people who are involved with the birth of infants is important, and it is one of the goals of Operation Smile as well.
Yes, thank you, Helen.
Helen, for our next question, I wanted to ask about breastfeeding in relation to Operation Smile's patients. Can an infant with a cleft condition be breastfed?
Yes. When we refer to breastfeeding, we typically think we have an image of the infant at the mother's breast. We have to remember that breast milk, though, can also be provided by different means to the infant who has difficulty latching on to the breast, or one who cannot achieve the suction needed to efficiently pull milk from the breast. So whether or not a baby can be breastfed varies depending on the condition. If there is a cleft of the lip, very often there are some minor adjustments that are required, but many babies who are have just the cleft lip can breastfeed. When the child is born with a cleft palate, it depends very much on the unique condition of that child, what type of cleft it is, the extent of the cleft, the locations of the cleft, or whether it's binary, a bilateral cleft or unilateral cleft, etc. But importantly, difficulty breastfeeding does not mean that breast milk does not exclude breast milk from being the main source of nutrition for the baby during the first 6 months of life. It is one of the reasons why we are there to help. It is the main reason why I help parents, is to have them experiment with other tools or implements to see what actually will work best for the baby. And I don't know, Teresa or anybody else, are there additional considerations about breastfeeding for cleft infants with cleft conditions? I'm not sure if I covered everything.
I will hop in here. All the good benefits that Teresa and Helen is talking about for our patients to be breastfeeding or to get breast milk, because our goal is that our patients do not become malnourished and that they are so well fed so that by the time the surgery comes, they are healthy and they are not malnourished, so that their bodies can tolerate the surgery as well as the recovery after. So we encourage anyone that want to breastfeed, anyone that struggle, to just ask. If you are, for instance, on Operation Smile mission or in a hospital, usually the family is so helpful and friendly that the mothers can just ask anyone, and then we will direct you to the right person to help you with their expertise.
Yes, I wanted to add to what my colleagues are saying. It's important to know the how of something when you don't know how to go about it. So with all the benefits that the breast milk gives to the child, the knowledge empowerment that is given to the mother or the caregivers is very key, so that the right thing is done. You could have a very good thing in the form of the breast milk, and the mother may not know how to go about adequately breastfeeding the child. So there's a good thing, but there's a gap when it comes to the how or the empowerment through knowledge for it to be done rightly. And so that's what my doctor is saying. Just ask and get to know what to do, and then do it rightly for the child. Thank you.
Are there any other challenges infants with cleft lip and cleft palate face when breastfeeding that we haven't mentioned today?
I think
I want to come in with, yeah, thank you, Ashley. Thank you, Charlotte. I want to talk about the stigma that some of the mothers or caregivers of a child with a cleft condition face. So because of that, they are not comfortable to breastfeed in public or where people are, even when it's time to feed the child. So when it comes to that, the support that is given to the mothers or the caregivers is very key. Once they feel like they should hide the child or not bring the child out, it goes in a long way to affect breastfeeding, affect the nutritional access to that the child is given as well. So we have to look at the stigma that is also attached to the cleft condition, and then work to once again empower people with knowledge about the condition, and then in the long run make the mothers comfortable to breastfeed their children everywhere they find themselves. Thank you.
Yeah, Dede, I think you touched on a very important point. I think they're also very afraid when the child is first born and they don't know, can I breastfeed? So it goes a little to what we were saying before, help and information is key to ensuring breastfeeding in those first few months.
Yeah, and I know, Teresa, also to add on to what both of you said, it's, you know, we've already talked, I've mentioned about the potential difficulty of latching onto the breast, or the ability to create suction is almost impossible often to pull the milk from the breast. But additional challenges, and this happens just for feeding in general, for whether the child is being breastfed or given another form of food, especially in the early days before patterns are established, and if the mom is new to this, and most are, it's some of the major challenges are that lead to frustration and exhaustion too for the parents include the length of time it might take to feed an infant with a cleft condition. The milk escaping from a baby's nose is startling and sometimes scares people. The excessive air intake that a child with a cleft condition will have when they're eating or drinking. And choking occurs depending on the flow of the milk into the mouth, and that they may not be able to control as easily as another infant might. And not knowing, especially if you are breastfeeding from the breast, and this is common to any mother who is breastfeeding, you always hear the question, how will I know how much milk the baby is actually swallowing and ingesting? And that's, information that can be shared, and the education can be provided to the mother about how to go about adjusting for these conditions. And again, we go back often to finding the best position for the baby to feed successfully. This is why it is not, you can't give a textbook answer to all of these, because each child is so unique that we have to work directly with the mom to achieve the best outcome for that child, so that they will have adequate nutrition, whether it means from the breast or from a bottle or from a specialized cup, which I had here somewhere, or other means that that will enable the child to be as well achieve as the optimal nutrition necessary for surgery to occur. So.
I just wanted to hop in really quickly and follow up on some of the conditions regarding the environment. Right now, we're living in a pandemic, and I would love, Teresa, I know we've had conversations outside of this webinar around breastfeeding and COVID. Can you speak a little bit more about that?
Yeah, of course. Like we have discussed before, COVID-19 came and changed everything, changed our world. And it is very important for mothers who are breastfeeding to understand how it impacts on breastfeeding. So first of all, if you do have COVID, you can still breastfeed. You just need to take the necessary precautions as everyone else. If you have COVID, wear a mask, clean your hands, wash your hands. So you can still breastfeed your baby. You can still hold your baby. A father who has COVID can still hold his baby. So that is a very important information. It's very simple information that should be out there. Also, for people who want to get vaccinated, we know that mothers can be vaccinated. None of the current vaccines have live viruses, so the virus is not transmitted through the breast milk. not when you have COVID, not if you get a vaccine. So that is also very important to help fight COVID and keep breastfeeding.
Awesome. Thank you, Trace. Just a question for you, Dede. You know, being on the ground in Ghana, can you share an experience from the field that you have had running Operation Smile nutrition programs? Because you have run multiple hundreds of programs, and we'd love to hear a bit more about your experience.
Thank you, Charlotte. As you said, I have a lot to talk about in line with that, but I'll just focus on just one case study that I had of a child who was being starved because of the superstitious belief that comes in certain societies when it comes to the cleft condition. So they thought the child wasn't human. So they thought they would starve the child and let the child pass away. But when we got the child, and through empowering the mother and then the father with knowledge about what the cleft condition is about, how to go about feeding the child, what to give to the child, there was this transformation that has always been what has blown my mind when it comes to all the experiences that I've had. Once there's a right intervention that is given to the families on how to go about caring for the child, you see that transformation. A child that may have been at death's door, and that's not an exaggeration, all bones and skin comes in, and then when the right thing is done, you see this child change, become healthy, become stronger, and then actually get a corrective surgery done. And that is one of the fulfilling things I've witnessed and I keep witnessing. So once again, I'll say it's all about that right intervention. Let's get to the ground, give the parents the right intervention, and most of them are willing to do the right thing for the child. And then once it's done, the child does very well. So that's just a few experiences I've had in the field. Thank you so much.
Thank you for that, Dede. Helen, I have a question for you next. When we were building the Nutrition Council, we knew it was imperative that we have a member on the council to represent our speech language pathologists because the specialties of speech and nutrition are so connected. Could you share a little bit more with our viewers online today about the link between nutrition and speech?
Yeah, sure. I would like to first, though, acknowledge what Dede said. This is a big part of also what we as speech pathologists do, is provide education to the mom. Over the years, I personally refer to Smile missions as mother's missions, because if I can educate, if we as the team educate and demonstrate and share with the mom what to do and watch her learn and learn to trust in herself as well, I think I have done, that is a big part of my job on a mission. And as speech pathologists, we need to educate, because in many of the locations where we go, the parents who are returning, when they return back to their home, will not have anybody else to look to, or someone that is easily accessible for them. The connection between nutrition and speech is, I think, probably obvious, because optimal nutrition helps us develop cognitively and physically, having the right types of food and the right way, having a way of feeding that moves, forces the infant to move their musculature, is stimulating the muscles and the organs related to speech, and helps them to develop, helps the child's body develop the appropriate muscles and oral structures. But when I'm dealing with someone who is struggling with feeding their child, my first emphasis is on the safety of the feeding. So I will be working with an infant with a cleft condition, and I will first address, usually, and there will be a big emphasis on positioning and determining if the child is, whether or not the child is taking milk in safely, so that pneumonia or other infections don't develop. So the feeding process should minimize the possibility of milk entering the lungs or the middle ear space, so that bacterial infections don't develop. The eustachian tubes at that young age are horizontal. They change as the positioning changes as the child matures. So the eustachian tubes very often get infected, especially with children who have cleft conditions. So that's something to be aware of and to educate the parents about. And then, of course, we want to ensure that the baby gets enough nutrition in a way that will minimize frustration and minimize the exhaustion that parents experience. So we work with the mom and the family to determine on the best way to deliver breast milk optimally, or other forms if that is what is necessary. So again, I'm referring back to, again, also to the bonding, the effect of bonding on development. For speech especially, speech is communication, and we begin communicating from the moment we're born. And the first months, weeks, days of after a child is born are extremely important for developing that bonding between parents. So if a mom is able to feed that child comfortably, and if we can minimize any frustrations for her, that the bonding can develop much more naturally. And babies who cannot breastfeed or are given breast milk using other implements can still be put to the breast for non-nutritive sucking, to help them develop, to stimulate the oral musculature that are important for the development of speech. So even though the actual breastfeeding may not be possible, we can still encourage and have opportunities for the child to do non-nutritive sucking. And I referred before in our discussions as a group to the kind of sucking that I often see among our children. Our moms would often wear wraps, and those infants very quickly learn how to stick the knot or the ends of the wrap into their mouth and suck on it in their best possible, in the way that they are able to do so. So there are a lot of things for us to teach, and also encourage the mom to share with the rest of the family, so that everybody understands the situation. So
Thank you so much, Helen. That's great, and that's really fantastic to make that link to speech therapy and your role as part of the Operation Smile team and medical volunteer team. I just want to remind everyone that's on the line with us, and really appreciate you all being here, that we do have a chat function. If you have any questions, you would just submit it by clicking the circle with the question mark in it on the right-hand side of your screen, and then you could input the chat question or the question or comment that you have. We do have a couple questions that did come in. The first is, why is it so important to establish these programs in low and middle income countries? Why do we believe, as a nutrition council, that it is important to establish these programs in low and middle income countries? Does anyone want to take a first go at it?
I can start off. You go, Teresa. I mentioned before as well that it is so important that we want the patients to be well fed so that they do not become malnourished or start to fail to grow properly, as it's often the surgeries happen a little bit later in their life by the time they already grow. So we hope that they grow well in order to tolerate this feeding, to tolerate the surgery, and to be able to recover afterwards is also very important, because otherwise it will take very long if they are not well nourished. And another point in establishing, for instance, breastfeeding in some of the areas that we are, the benefits is that it is always available and it's always clean. Sometimes we have issues with having clean water available, for instance, to have feeding for babies. However, if we can work with breastfeeding or breast milk, then it's always the right temperature, it's always available, and it's always clean. And it's also good for the environment, because we will not have bottles to wash and put chemicals into the environment or expose of any kind of plastic containers or so that formulas are in.
Yeah, I wanted to add on to what you just said, Elsa. When we work with moms who cannot breastfeed or provide breast milk directly, when we introduce the other tools or implements, that is one of our big considerations, and it is a big part of our education, is to emphasize the necessity for cleanliness and ease of cleaning. So that's part of the education to our other health professionals that we work with, that some of the bottles that we may bring in from where I live, when you read the directions, there are 7 or 8 steps required to clean some things, some of the specialized bottles. So we really have to think very carefully and be aware of the context where we are providing our services. So there are now some specialized cups, and there are specialized bottles that require that have minimal crevices and nooks and crannies where bacteria can accumulate. It's one of the things that we have to be aware of and learn and teach ourselves, educate ourselves, is educating ourselves about the country that we are going to be, where we will be providing our services. The economic context, the cultural context, and the environmental context are as important as, for me, as knowing the sounds of the languages spoken. So.
Yeah, thank you all for that answer. We have a couple questions that came in the chat, and one actually is specific around milk expression, maybe the differences between manual milk expression and using a pump, whether that's a manual pump as a supply, and maybe what the differences are and the use and why some mothers need to express milk.
Anybody?
I can go. So we have, you can do, so manual expression, use a manual pump or an electrical pump. The problem in the countries that we visit with Operation Smile missions or even cleft centers is, like Helen was saying, there is no electricity and it's much more complex. You need to clean it. So a manual expression is easy. Well, not easy, but it's something we can teach the mothers, and it requires very, very little technology. A manual breast pump is also useful because it is only our hand that will do the pressure, the negative pressure to express the milk. Some mothers might not adjust to that. So I know a lot of mothers who prefer to express it directly from the breast and not use a pump. But basically the difference is with a manual pump, you use your hands, and with an electrical pump, you need electricity, and normally you have multiple speeds, and it can go much faster, but it can be painful for some mothers. So you really need to find out what is the best for that mother.
Right. And I wanted to refer to an article, a relatively recent article where that did a review of pumps and ways of pumping, expressing breast milk. And there is some, positive, what do you call it, correlation with manual pumping for developing breast supply, increasing the supply of breast milk. It seems to increase more via manual pumping or manual expression versus electric. And also just also the other part that stimulates breast milk supply is allowing that child, allowing your infant who may not be able to get milk from the breast, but to have non-nutritive sucking, which stimulates the breast milk supply. So that's another thing to consider.
Thank you all for those answers. Just two more questions. One actually for you, Helen. What are the long-term speech impacts when a patient or when patients with a cleft palate do not use proper muscles while feeding?
So long-term impact that's often referred to in articles about this is like the lack of development of the jaw, not developing appropriately, the palatal, the palate for the teeth doesn't develop, the musculature doesn't develop internally as well. However, one of the things that I also emphasize is that we want exclusive bottle nutrition or breast milk or some sort of nutrition that's strictly liquid for the first 6 months. Those 6 months is when we really emphasize the need for breast milk. But we also very often want the child to learn how to begin to sip from a cup, because depending on the country and the type of surgery they're having, sometimes we are asked by the doctors that beforehand that child be able to drink from a cup, because in some places they don't want that bottle feeding immediately after surgery. So there are a lot of variables involved, but mainly it's that sucking is a natural reflex, and it's a natural exercise that will help, that helps develop all of the internal structures of the mouth. And however, there is not a whole lot of review of evidence of those conditions, frankly, around the world. What we have are mainly Western studies that look at non-development. The other thing, though, that goes, that also is not a good thing over a long period of time, is when a child only drinks from a bottle and doesn't develop or insist on using a pacifier. That also can have contraindications for appropriate development.
Thank you, Helen. Really appreciate all your knowledge on that. The last question, and Ashley, I'd love to have you answer this one. This viewer said, thanks for this great meeting and for the great panel. I wanted to ask how our student club can join the activities or initiatives of the Nutrition Council.
Yeah, Charlotte, that's a great question. Our nutrition team has been working really closely with the StudPro team here at Operation Smile to work on building out modules for students around nutrition education and WASH initiatives. So stay tuned, this will be rolled out by the StudPro team. And then we're also working on identifying ways that we can work around WASH and nutrition education by connecting our in-country teams with our international student teams. So right now we're still identifying what exactly that will look like here to connect our teams around the world and our students to share more information on nutrition education and WASH. And with that question, Charlotte, now that we've heard from our Nutrition Council and some questions from the crowd, I just wanted to ask if you could share a little bit more about Operation Smile's long-term nutrition plan.
Yeah, thanks, Ashley. Well, as we mentioned, COVID has definitely overtaken a lot of our activities and allowed us to scale up our nutrition interventions and global support for families living in food insecure households. Our global teams have been refining their comprehensive nutrition programs, and these include education, as we've spoken a lot about today, to promote social behavior change and that importance around education specifically on nutrition, healthy foods, and breastfeeding, as well as water, sanitation, and hygiene. And we're also working closely with the various in-country ministries of health and national offices of nutrition, as well as local NGOs to find in-country solutions. Operation Smile and all our teams globally are saving lives through our nutrition interventions, and we haven't stopped programs, although this pandemic has definitely made it more challenging for us to offer surgical care. We are doing the best to keep our patients healthy and fit for surgery as we come back into the field. Our teams around the globe are working diligently, not only to empower, but also to support and educate these families around nutrition and healthy habits all around. We're committed to creating a world where every single mother and family has the support that they need to breastfeed, and that no one breastfeeds alone. I think we heard from all of our panelists today that we all have a role to play in supporting breastfeeding. And together we can make that difference. Each individual, all of us as medical professionals, as volunteers, as family members, we can absolutely make that difference. And if you're interested in learning more about our initiatives and our activities and the resources and efforts that we've done, we have all of those on our website at www.operationsmile.org. So please feel free to check out our website and check out the amazing blog posts, different great editorials that we've written around nutrition and healthy habits, ensuring healthier lives and breastfeeding. And I wanted to take this time to thank all of our panelists, this group of strong women, for their time, their love, their energy, and their compassion to Operation Smile, and specifically to our nutrition efforts and the most vulnerable of our patient population. We cannot thank you enough. And thank you all for viewing our webinar. We really appreciate your time and have a fantastic day.